Welcome back everyone to my page Diabetes Score by Dr. R. Khan. I hope you all are doing really well, and I would like to discuss about type 1 diabetes today so that you can get some kind of information related to it. And type 1 diabetes is also known as juvenile diabetes or insulin dependent diabetes. So as the name indicates, it is just dependent upon insulin. And where does the insulin comes from? There is an organ in body which is known as pancreas. It is responsible for producing insulin, which regulates the whole glucose in the body. So in type 1 diabetes, actually, our body is fighting against the immune responses, and it actually uh, attacks the beta cells of pancreas, and pancreas is not able to produce any kind of insulin. So that is why type 1 diabetic individuals want insulin externally. So how does that really happen? It is dependent upon many factors, but some of the factors could be genetics, environmental factors, chemical, or some kind of drugs as well. So when I was searching about the genetics, I always used to think that mother is more dependent to give type 1 diabetes to the children. But in contrast, I got to know that there are only 2% of chances if the mother has diabetes, child will develop diabetes. If the father has diabetes before, there will be 8% of chances for the child to develop it. So that means it is more dependent upon father. And if both the parents have it, let me just check it again, it will be 30%. And if the sibling has it, it will be 10%. And if there are identical twins, and if one twin has it, that means the other twin will have 40% of chances to develop it. So it really doesn't mean that it is totally dependent upon genetics. If you have healthy lifestyle, if you're having less glucose in your diet, less carbohydrates in your diet, and you're having proper exercises, and if your lifestyle is balanced, so you will never be able to develop it. So these are the preventive measures that you are not going to have it. So if we will come towards the treatment, so there are only two treatments for it. Basically just one, that you need to have insulin injections or insulin pumps. You cannot live your life with tablets if you're having type 1 diabetes. But just not to worry about it. You can totally reproduce well with type 1 diabetes, and you can have a good lifestyle with type 1 diabetes. And we researchers and doctors, so many doctors in the world, are in the search and the effort of they're struggling to find out ways where we can have less invasive treatments for type 1 diabetes, and people cannot have to inject themselves every day, twice in a day. So I'm sure there will be some researches and there will be some outcomes for this kind of diseases, and I'm sure there will be some positive outcomes related to it. So I hope this will be of some kind of information to you guys, and I would be really happy to see your comments and listen to your questions related to any kind of diabetes. And thank you for listening to me. Stay tuned, and I will see you guys next time. Bye.